Yeah, I mean, it's a difficult time in the industry for a lot of folks, but in a lot of ways, it's kind of AI's time to shine, right? Like we're seeing decreased human resources, but that's where AI is really supposed to pick up the lift. So I think AI can really augment a lot of basic tasks. It can leave, and ultimately, hopefully, leave research teams to practice more at the top of their license. Like let's take the dirty work off your plate and let you focus on the things you came here to do, which is see patients and care for patients. And so, this is going to be very slanted based on like, a lot of the things we work on at Triley, but some of the big exciting things that I see folks getting excited about for AI are one, AI powered patient identification. AI can sift through large amounts of data from EHRs, from CTMS systems, even from PDF documents, taking, what is, 30 plus minutes, hours of time reading through patients' charts down to moments. And that's huge. So we've had sites where we have teams that do 90% less chart review than they did before the system gets implemented. And it's doing things that, frankly, like, I spent maybe quick example. I spent my entire career before this, before, basically OpenAI and Sam Altman happened, telling physicians that if you write it in a note, it's gone forever. In the time I spent at Epic and Cerner, like that was the message, is it's got to be documented discreetly. And that's just not true anymore. Like we can sift through a lot of that information and do it really quickly, which is powerful. Like that's industry shifting capability. So that's one. Other would be, if we're already in there, sifting through all that data, you are resource constrained as a site. Picking the right study, picking the studies that you're going to crush it on is really important. So the ability to actually, do real-time feasibility on that data set and understand, do I have a population that supports our research, us taking on this study is really big. So, real-time feasibility, real-time business development, and site select or trial selection without guesswork are really big things. And then the last I'd call out is, hear a lot about like automated pre-screening and engagement of patients with AI voice. You can call, screen, and actually engage these patients directly with very human-like capability. And that's a huge lift for sites. Like in my time actually working at a site network, it was a massive pain for all of our research coordinators to have to call, say we're doing a vaccine study and we have 10,000 potential candidates. How do you call all 10,000 of those people to try to screen them into a trial? And AI can really take the front end lift of that, take the initial outreach and then hand it off to a human to really close the deal and bring them in for the study. Yeah, so there's probably 1,000 more use cases that I didn't hit, but those are some of those that are closest to our hearts.